I want to follow up on some of my questions to the Minister with the Public Health Agency of Canada with respect to the June 30th timeline and the restrictions in place at the border. Are you able to provide us today with the metrics that are being used to sustain or to allow those restrictions to expire at the end of the month, please?
Mr. Chair, I think one of the things which I would say in essence is that we have metrics which we use regularly in terms of how do we provide advice. The guidance advice is based on scientific evidence which is available on effectiveness, availability, and uptake of vaccines. What is evolving domestic and international epidemiological situation, and the effectiveness of other public health measures to keep the people safe. So there are a few of those metrics which are actually looked into in terms of the making sure that we have taken every reasonable precaution and to protect the health and safety.
Yeah, I appreciate that, Doctor. What I'm looking for specifically is if you can provide what the goalposts are, so Canadians know when we've got the touchdown. So before we talked about a 2-dose, a series of the COVID vaccine, and we had wild uptake, very positive uptake on that. We haven't seen the same with a 3rd dose. But now with natural acquired immunity from Omicron, with the portion of the population that has had a 3rd dose, with the well over 80% of Canadians that have had a 2-dose series, are we talking about vaccinations as the metric that you're using, or is it about wastewater surveillance? Is it about hospital capacity? And what I'm looking for, instead of hearing what the basket of areas that you're examining are, do you have the numbers that you have advised that you're using to advise on? And if you have them, are you able to provide those to this committee?
So, Mr. Chair, as I mentioned earlier, these criteria, as mentioned earlier, are the main ones which we use. Of course, we do take into consideration the wastewater surveillance. Of course, we take into consideration all the other factors which are mentioned. We are continuing to kind of look at that in a global epi context. There aren't any firm numbers or anything which can really be pinned on to that. This is it depends upon how much is the coverage of the vaccination, what is our current public health measures, and what it is in terms of our hospital capacity. So all of them taken together, we do the modeling, which is presented, and based on that, we continue to and put together all of those public health measures, which includes vaccination, recommending 3rd dose as per the National Advisory Committee on Immunizations advice. So quite a few of those are continuously in essence.
And I understand that, Doctor, and that's the similar answer that we've received from PHAC over a period of time. But really, there has to be a number at which that you've identified at which it would be acceptable in each of those epidemiologically important categories, that then you would make a recommendation that now is the time to lift the mandates. So in each of those areas, are you saying that there is no number in hospital capacity, there is no number in wastewater surveillance, there is no number in community transmission, there is no number in vaccination uptake, there is no number in terms of community spread in other countries, that once those numbers are hit, that it would be safe for vaccine and mask mandates to be lifted?
Mr. Chair, what I am actually mentioning is that all of these variables, they are taken into consideration.
We understand that, sir. But what are the numbers?
As I mentioned, Mr. Chair, this is a combination of different metrics. There aren't any specific numbers which we could actually say, because it depends upon the activity of the virus in the different communities, as well as the different settings, and also the protection which is provided to the population from vaccination and other public health measures like masking, hand washing, and others. So there's a multitude of combination of factors which allows us to take those kind of public health advice.